I'm here with Dr. Rucker to go over some lab results, which are tremendous in regards to our patient who did our antiviral package to help with herpes. So I'm going to let Dr. Rucker talk about the lab results and ask him some questions. So I guess the first question is, what are you seeing since the patient's come here, since November to June?
This individual discovered our practice because he knew we utilize advanced therapies that seem to be rare and unconventional that help our patients manage immune system insults such as viral disease. In this case, the patient had a clinical diagnosis of oral herpes, which is HSV, herpes simplex virus 1. He had a titer done for herpes. By way of background, one of the more typical methods used to diagnose herpes simplex virus is the antibody titers in the bloodstream. The body's developed antibodies against the virus. The two types of herpes viruses that are commonly treated are herpes simplex 1 and 2. Typically, 1 is the oral herpes. It presents as little fever blisters or cold sores. Those are the oral outbreaks. And then the other type of herpes manifestation, which is obviously somewhat of a personal, private, and even embarrassing diagnosis to many in this country, is herpes simplex 2, which is the genital version of herpes. Both of these are generally considered incurable, and patients have to take suppressive treatment with antivirals that only suppress the outbreaks and the symptoms, and patients are considered to be afflicted for life and diagnosed for life. We've developed a protocol that we have witnessed patients stop having recurrent outbreaks, and we're pretty excited about this case that I'm presenting because we are watching the antibody titers decrease in this patient who underwent our antiviral package or protocol, as we call it. So in this case, the patient's titers were as high for herpes simplex 1 as 20 on November the 19th, 2016. Then he finished a 6-week course of our recommended treatment. He followed a supplement protocol I created for him. So the IV treatment's a supplement protocol, and he also followed the nutritional protocol I created for him. And by February 25th, 17, his herpes simplex 1 titer decreased to a value of 4.87. And then on June the 8th, 2017, just a few days ago, his value came down to 2.68. Once a patient is under 0.91, he's considered negative. So we're witnessing this patient literally have less antibodies in his bloodstream after following our protocol. So we're quite pleased with the results. And it's sometimes it's hard to get a patient to follow through diligently on providing all the blood work, and this patient's been very active in his health care and very organized and meticulous in following our instructions, and we're seeing an excellent response. So that's why we're pleased to present this information.
Now, with this particular patient, Dr. Rucker had recommended a 6-week protocol, once a week. So now you're thinking our patient should be coming once a week for 8 weeks.
Yeah, I think from researching other doctors who do these protocols and observing their success rates, 8 weeks seems to make a lot of sense. It's a nice, powerful, consolidated protocol, and the first 2 weeks allow us to build up in dosage to get to the final doses. So that's where I'm coming up with an 8-week protocol. Makes a lot of sense for the patients.
This is a question probably from our patient and from others. His numbers are at 2.61 now. Can his numbers go lower?
Well, the truth is ozone is a very powerful, documented deactivator of virus, fungus, bacteria. So it is possible through the use of ozone that he could eradicate the presence of this virus in his bloodstream. And if the virus is eradicated, there's no ability for the body to make antibodies against something that doesn't exist. So in a In a case of a patient who eradicated herpes, I would expect the numbers to go back down to 0. There are no strong clinical trials or any studies because this is not patentable techniques and this is not something drug companies are interested in. So the only instances of this are going to be case report presentations. So you could argue that each time I do a video like this, I'm presenting a case report of one of our patients. So it's inarguable that this is a legitimate patient who's under our care and we have his lab results. So what is the extrapolation that I would make? That here you have a gentleman with antibody titer of 20, and after our treatments, we've seen it recede down to 2.91. And I would love to optimistically say, that I won't be shocked if we see him go back to less than 0.91, which would be indicative of no presence of virus in the body. So that is our goal, and I would love to see that happen. I can't predict it, but it's possible.